Welcome back to our overview of the Miami University Clinical Psychology Doctoral Program. We're going to be talking about clinical training for these next few minutes. So let's walk through a little bit what the milestones are throughout the course of your time. So in year one, there isn't a whole lot of direct clinical work. Really what's happening is that students are setting the foundation for their later work. This includes didactic coursework in things like ethics, intervention, psychopathology. Now, there are some opportunities. For example, Dr. Green in our department oversees school-based mental health services, and with that sometimes she has students who help out with things like the Incredible Years program, which is a social skills building program that's instituted in local elementary schools, and our first year students help out with that project. It's a really fun project. You get to be puppets, different kinds of puppets to help with Dinosaur School, which teaches social skills. So it's a great program and a way to start building some of those foundational clinical skills. In year two, however, is when our clinical training really kicks into gear. So in year two, all of our students work in our all of our students work in our clinic doing practicum. In the first semester of your second year, this is an adult practicum. So even if you are adults focused or child focused in your clinical work, that first semester you're doing an adult practicum in therapy that's supervised by in-house faculty, either a tenure track faculty or non-tenure track faculty, or our clinic director is supervising that therapy work. In the second semester of year two, this is when you'll be doing either another adult therapy practicum if you're adult focused, or you'll move into a child and family therapy practicum if you are focused on children and families. Then in year three is when things really pick up. So in year two, you're also doing didactic coursework and things like assessment. In year three, our students are doing both in-house clinical practicum and assessment in the fall, and then intervention, either adult or child, in the spring. At the same time, you're doing external practicum, which here at Miami we call external traineeship. Now, external traineeship is typically 20 hours a week at some external community-based site. And we'll talk about where some of these sites are, and these are developmentally sequenced so that you get more hands-on training with potentially less severe pathology in year three, and then by year four that increases. So in year three you're still kind of balancing some things in our own psychology clinic, and then you're also working out in the community. So it gets to be a pretty busy year clinically speaking. In year four, then, the in-house clinical practica are finished, although some of our students still may carry a long-term client or two, but primarily clinical work is coming through the external traineeship. So the external traineeship, again, our practicum, this would be 20 hours a week out in the community. Now in year five, our students are doing a whole host of things. In terms of clinical training, they may be doing some ongoing work in the clinic, but they may also have an external traineeship, or we have one position in our clinic, which is the clinic doctoral associate. This is essentially, you can think about this as sort of an assistant clinic director who helps with sort of some of the intake processing, oversees our case conference, helps with some teaching responsibilities, and then also provides some training and supervision as well. So that's sort of the progression that students go through in terms of clinical work. Now, our training clinic serves primarily community members, although we do see Miami students as well. And I would say it's about a 50-50 split actually in that way. We have testing rooms, individual and couples rooms, as well as a group and child therapy room and a conference room or two. we're a modern clinic with electronic record keeping, and we have the ability to do live or recorded supervision. Our staff is our full-time clinic director, Dr. Evans Tobin, as well as our program assistant, Janie Shupi, who is amazing and the nicest woman that you'll ever meet. It's a shame that you won't be able to come visit us. She does a lot of work helping to put together the visit day, and she loves meeting the new applicants, and we love making sure to thank her for all of her hard work with this visit day. And then, as I mentioned, the doctoral staff's that position is 20 hours a week in the clinic. In terms of our clinical training and the number of clients that we see, as well as our external practica, in-house we see approximately 150 to 200 clients each year, and that turns out to be about 800 sessions per year. As I mentioned, we see both community members from Oxford and Hamilton, which is a nearby city, as well as Indiana, which we're pretty close to. We're about 6 miles away from, as well as overflow from the Student Counseling Center. Our Student Counseling Center actually has a very short-term model whereby they don't see folks for much longer than 5 or so sessions, so we tend to get some of their more complex cases that may need some more time. I would say in your first year in the clinic, in the first semester, you're carrying a caseload of about 2 clients, and then as you ramp up and get more, sort of develop more competence, you start seeing, anywhere from 3 to 5 clients in the clinic per semester. That's in our second and third year. In our third year as well, students are out on external practicum, what we call traineeships again. We have locations throughout Oxford, as well as some in Indiana and Cincinnati and other nearby communities. These include things like research hospitals, state hospitals. We have inpatient treatment centers, residential treatment for youth that are affiliated with the Juvenile Justice Center, some counseling centers, community mental health, as well as private practice. So you can see you've got a wide range of things. I would say recently a lot of our students have been working at a couple of primary places. These include a private psychiatric hospital, our student counseling center, Cincinnati Children's Hospital, as well as some of our community-based partners that are mental health physicians. Now, while you're out on traineeship, and we'll talk more about funding in another part of this overview, but I just want you to know that unlike a lot of other programs where this kind of clinical training might be volunteer, in our program, students receive their tuition waiver and stipend for these external traineeships. Now, we do have some places like VAs that don't pay, where if we can work it out, we can get some volunteer experiences there, but our primary traineeships are paid for the full tuition waiver and stipend. Just want to let you know that a lot of our clinical training does require background checks, and so upon admission you'll undergo a background check conducted by our human resource position or department here. As well, obviously a lot of our trainee sites request this periodically, as do most internships prior to start. Let's talk a little bit about internship. So we have excellent match statistics. Virtually all of our students match at APA accredited internship sites, and in fact almost all of our students match. Our match rate is 98% in the past 10 years. Actually, if I include, I think that will become 100% after this year, so that the last student to have not matched was actually about 10 years ago at this point. And that person didn't match because of some significant geographic limitations, and that made it difficult to find a good spot. But ultimately that person ended up finding an internship outside of the match process. So again, virtually all of our students are matching at APA accredited internship sites. We actually require you apply to those. The few situations, again, were highly atypical. I think our internship matching process is something that I'm very proud of as the Director of Clinical Training. We have extensive mentoring and preparation. There's information and advice throughout the program. We have an individualized method to identify the number of sites and how to look and locate those. There's ongoing assistance from multiple faculty member with application materials and essays and practice interviews, and I think that's why we've had a really good response in recent years. In the past 3 years, actually, our cohorts are averaging greater than 10 interviews. And if you look at the scientific literature, basically 6 is the magic number. If you land 6 interviews, you have about a 97% chance of matching in that plateau. So having more interviews doesn't help you match. And our students are landing about 10 interviews or greater on average, which is wonderful. Here are some of the kinds of places that individuals are matching for internship. So a lot of research hospitals and academic medical centers, some state and private hospitals and VAs, as well as consortia. I would say that in the past we've had more of our students going to student counseling centers or community mental health, but in the past 5 to 6 years, most of our students are landing at academic medical centers or VA hospitals in particular. I'm actually having trouble thinking of folks recently who haven't been in one of those kinds of locations. So we've had a lot of good success in that route. Of our graduates in the last 2 to 10 years, about 85% are licensed. All of those who aren't licensed are in careers or locations where licensure isn't necessary. So either these were folks who moved internationally after graduation or who are in positions that don't require licensure. Of those who have taken the licensing exam, the EPPP, we have 100% pass rate. And our program alumni score consistently higher across areas on the EPPP than the national average for accredited programs even. So I think we do a great job of preparing students for that next step. Here are some of those recent internship sites that you can see. I've listed a number of different types, so the Aurora Community Mental Health Center, and then you see just a long list of academic medical centers and health science centers and children's hospitals, as well as a number of different Veterans Affairs, Phoenix, Memphis, Michigan, and so you see a whole range of different kinds of sites where people are landing, as well as down at the bottom a few student counseling centers. And again, those have primarily been 5 or 6 years out. Not that I don't think our students would be competitive for those sites, it's that their career goals have not matched up with that. So that's a little bit of overview of our clinical training. I would say by the time students apply out for internship, most of them have accrued anywhere between 650 to 1,200 clinical hours, with an average of about 800 clinical face-to-face hours, a mix of therapy and assessment. We tend to have folks with higher therapy numbers. That's pretty consistent across the nation, but we do have a number of our different traineeship sites which will increase those assessment hours. So until our next time, take care.